Hi, I'm Saeed Sadrameli, a board-certified neurosurgeon in Orlando, Florida. My area of expertise are endoscopic spine surgery and minimally invasive spine surgery. Truthfully, there aren't many standalone cervical cages available in the market that would sort of meet the standards that I utilize in my clinical practice. And so when I saw NanoHive, I think right off the bat, the 3D printed technology mixed and linked with the soft lattice, which was the patented technology unique to this product, caught my eye. But I think that with this technology, I feel like there is even more to be done with regards to reducing subsidence and achieving better outcome. I know bony on-growth is another big selling point for me with regards to these standalone cages, but now I utilize it heavily in my practice across the board from C2 down to so far C7, I believe. I haven't done any C17 one yet. When I acquire new technology in my practice, I tend to want to sort of run a mini sort of control trial of my own to really see the efficacy and the clinical promises that are made from the technology. And so I was fortunate to be able to work with NanoHive here to do a prospective study looking at 20 patients as a pilot study. These were standalone cages from C2 down to C7. I used a combination of zero profile and plated implants for this study. And we looked at imaging, so data from 6 weeks with the X-ray, 3 months with the X-ray and CT, and now that we've sort of walked away from earlier surgeries, we do have data on a 1-year CT scan and X-ray to look at the technology. And so far, thankfully, there haven't been any failures, no reoperations that were needed. Also, our subsidence rates were 0 in this study. And we did not have any pseudoarthrosis that requires surgery based on CT scan at 1 year of the patients that have, made it to the 1-year mark, which is probably majority of them at this point. And this was a combination of 1 and 2 level cases. I do believe that rate of swallowing difficulty or dysphagia is slightly lower in this cohort compared to the ones that are plated, especially in the higher cervical segment. And so I've found the zero profile or even a plated version to be very effective in performing the operation, and I've been very pleased with the rate of dysphagia that we've seen post-operatively. The other thing I would say is the operative time. The operative time is certainly lower in my hands with this technology compared to plated regular ACDF procedure. The ease of use and how seamless it is to be able to perform the surgery, both in the zero profile and the plated version, is another positive of the technology. And I think that you'll find it very helpful as a tool in your toolbox to be augmented with the other implant technologies that you have available in your practice.